What if a single movement could make the difference between preserving your independence or losing it over the years? Many overlook that aging not only steals strength but also undermines balance and mobility. The real question is, are you ready to discover how to reverse this process? Before we begin, I want you to understand that as we grow older, our body undergoes inevitable transformations, muscle mass decreases, reflexes slow down, and stability becomes compromised. These changes heighten the risk of falls and gradually reduce autonomy. Nevertheless, not everything is lost. A wide range of studies has shown that functional exercise is among the most effective tools to counter this process. That's why I want to share with you 4 practical and safe exercises that will help you strengthen your body, improve your balance, and maintain your independence day after day. Exercise 1. Chair-supported squat. Among the most common daily actions, standing up and sitting down on a chair holds a central role. When this movement is turned into an exercise, it directly strengthens the quadriceps, responsible for knee extension, the glutes, which provide power to the hips, and the hamstrings, which act as stabilizers during the descent. At the same time, the deep core, formed by muscles such as the transverse abdominis and the multifidus, helps keep the spine upright and stable. The controlled repetition of this motion trains strength, balance, and coordination all at once, elements that determine the difference between performing daily activities safely or depending on external help. What may look like simply standing up is, in reality, a strategy to reinforce independence in everyday life. Maintaining the ability to rise smoothly from a chair is far more than an ordinary gesture. It represents independence, safety, and confidence in one's own body. It is no coincidence that many training programs for older adults include it as a foundational pillar. Indeed, science supports its effectiveness. The American Journal of Preventive Medicine highlights that consistently practicing this movement is linked to improvements in walking speed and a significant reduction in fall risk. Likewise, a study published in the Journal of Geriatric Physical Therapy showed that integrating this practice into a strength and balance plan increases motor confidence and reduces anxiety related to the fear of losing stability. In other words, what seems to be a simple exercise ends up becoming a key tool to prevent injuries and preserve autonomy in daily life. On a practical level, its application is straightforward and accessible to anyone. The recommendation is to use a stable chair, sit with feet firmly on the ground, and keep the back straight before initiating the movement. The gesture consists of standing up in a controlled manner and sitting back down gently, without using the hands for support. For those seeking a more comfortable adaptation, it is possible to begin with partial repetitions, using a higher chair, or lightly resting on the armrests to reduce the load. With 2 or 3 sets of 10 to 15 repetitions, performed several times per week, the benefits become noticeable within just a few weeks: greater security when getting up, improved stability while walking, and better ability to handle everyday movements. Ultimately, this chair-supported squat not only trains muscles but also preserves the most valuable asset in adulthood: the confidence to move freely. Exercise 2. Glute bridge. Among the most valuable movements for preserving body stability, the glute bridge holds a prominent place. The act of lifting the pelvis off the ground not only activates the hip muscles but also engages the glutes, hamstrings, and the deep musculature of the lower back. By keeping the hips aligned, the transverse abdominis is recruited as an internal support, creating a protective effect that stabilizes the spine and distributes loads more efficiently. Thanks to this synergy, posterior chain strength is restored, posture improves, and compensations that often emerge with age, such as knee strain or lower back overload, are reduced. Each repetition, rather than being an isolated gesture, serves as a tool to regain control over movement and reinforce safety in daily activities. So then, why is it considered such a decisive exercise? Because numerous studies have demonstrated its effectiveness both in reducing discomfort and enhancing mobility. Research published in the Journal of Back and Musculoskeletal Rehabilitation shows that programs including this movement significantly reduce chronic low back pain in older adults. Similarly, the Journal of Physical Therapy Science emphasizes that strengthening the hips through exercises like the bridge lowers the risk of falls and improves dynamic stability. Put differently, its true value lies in going beyond aesthetics or muscle work. It functions as a preventive strategy that keeps the pelvic supporting muscles active, thereby sustaining the ability to walk, bend, or climb stairs with greater confidence. When it comes to execution, the key is progression and adaptation to each person's level. The classic version is performed lying on the back, with knees bent and feet firmly on the floor, raising the hips in a controlled motion until knees, pelvis, and shoulders are aligned. For those with joint discomfort, a cushion can be placed under the lower back to reduce the range of motion or shorten the duration of the contraction. As strength improves, it is possible to hold the position for more seconds or even attempt variations such as the single leg bridge, always prioritizing technique and breathing. Practiced consistently, this exercise provides genuine reinforcement for the lumbopelvic area, enabling older adults to maintain better posture, walk with security, and move without fear of instability. Exercise 3, Side Plank. Among the exercises that most contribute to trunk stability, the side plank stands out for its ability to activate both the deep musculature and the lateral area of the abdomen. By holding the body supported on one forearm and the side of the foot, the obliques come into play, responsible for controlling rotation and maintaining spinal alignment, the gluteus medius, which stabilizes the hip in the lateral plane, and the spinal stabilizers, which prevent posture from collapsing. This simultaneous effort translates into improved balance and active protection of the lower back, decisive factors for walking upright, turning the body with control, or reacting to an unexpected movement. Beyond strength, this exercise trains body awareness and the capacity to keep the center of gravity steady in different positions. Strengthening the lateral trunk not only adds firmness to the abdomen but also serves as a protective strategy against falls and imbalances, common issues in advanced age. For this reason, the side plank has become a widely valued resource within stability and postural control routines. In addition, it is supported by scientific research. Studies published in the Journal of Strength and Conditioning Research have shown that programs including isometric exercises such as the side plank increase core muscular endurance and enhance dynamic stability in older adults. Likewise, reviews in the Journal of Aging and Physical Activity indicate that training the obliques and stabilizing musculature not only reduces the risk of falls but also improves the ability to react to uneven surfaces or sudden changes of direction. In short, practicing the side plank is like building a natural shield that protects posture and ensures greater safety in everyday movements. The way it is performed can be easily adjusted to each person's needs. The classic variation involves lying on one side, placing the forearm under the shoulder, and raising the hips until forming a straight line from head to feet. Still, for those with less strength or looking for an initial progression, an alternative is to keep the knees on the floor, which reduces the load without losing oblique activation. Over time, difficulty can be increased by extending the legs, adding a small lift of the top leg, or prolonging the hold. Maintaining the position for 10 to 30 seconds per side and repeating 2 to 3 times is enough to achieve improvements within a few weeks. Thanks to this adaptability, the side plank becomes a safe and effective resource to strengthen the foundation of human movement, control of one's own body in space. Exercise 4, Bird Dog. Among the movements that best combine stability and coordination, the bird dog holds a fundamental place. By extending one arm forward and the opposite leg backward from the quadruped position, the body is compelled to activate the spinal erectors, which support the spine, the glutes, which power the hips, and the transverse abdominis, which acts as a natural brace to keep the trunk firm. Added to this are the shoulder muscles and the hip flexors, creating an integration that trains the ability to maintain balance while the limbs are in motion. This cross pattern reflects a natural gesture of walking and many daily movements, which makes the bird dog a highly functional exercise for enhancing dynamic stability and preventing imbalances. The bird dog is regarded as one of the most complete movements for training coordination between the trunk and extremities, something that gains tremendous importance with age. It is not just about keeping the back steady, but about teaching the body to move with control and balance in everyday situations. Its effectiveness has also been reinforced by scientific evidence. A study published in the Journal of Strength and Conditioning Research found that programs incorporating the bird dog improve lumbar endurance and significantly reduce lower back pain. Furthermore, research in the field of functional rehabilitation has shown that working with cross patterns increases neuromuscular control, in other words, the body's ability to activate the right muscles at the right time. For older adults, this quick and coordinated response can be the difference between regaining balance or experiencing a fall. Ultimately, the bird dog not only strengthens muscles but also trains the nervous system to react more effectively in daily life. Practicing the bird dog is simple and, at the same time, adaptable to different fitness levels. The The traditional version is performed by placing hands and knees on the floor, extending the opposite arm and leg simultaneously until they are aligned with the trunk. The goal is to hold the position for a few seconds without letting the hips rotate or the back arch. For beginners or those with limitations, it is possible to start by lifting only one arm or only one leg, alternating in a controlled manner. As stability improves, the challenge lies in prolonging the duration of each extension or trying more advanced variations, such as small pulses with the leg or holding a light object in the hand. The key is to execute the movement calmly, maintaining steady breathing and fixing the gaze on a point to support stability. In this way, the bird dog becomes an accessible and safe tool to reinforce body control and build confidence with every step. Benefits. And what is the point of dedicating just a few minutes to these exercises? The answer goes far beyond gaining strength. It is about investing in independence, safety, and quality of life. Each movement, from the power of the glute bridge to the cross-coordination of the bird dog, trains muscles, joints, and at the same time the nervous system, creating a protective network that activates during everyday activities. Science has shown that functional training, replicating natural gestures such as standing up, stabilizing the hips, or maintaining balance, significantly reduces the risk of falls, improves posture, and builds confidence in movement. This is not merely about exercising muscles, it is about training the capacity to remain autonomous, to walk with steadiness, and to perform daily tasks without fear of injury. So why do these exercises actually work? Because they involve large muscle chains and demand the joint participation of the deep musculature. According to the Journal of Aging and Physical Activity, programs that include transitional patterns, such as moving from the floor to a standing position or holding a lateral posture, improve stability and extend functional independence in older adults. Meanwhile, a review published in Sports Medicine highlights that multi-joint exercises, those requiring coordination between trunk and limbs, enhance both cardiovascular endurance and functional strength. These findings reinforce the idea that we are not dealing with isolated movements, but with comprehensive strategies that strengthen the body as a whole. Nevertheless, it is equally important to emphasize that each body is different. Progression should be gradual, paying attention to the body's signals and consulting a healthcare professional in the case of persistent pain or joint discomfort. Another aspect that cannot be overlooked is nutrition. Training is of little use if the body does not receive the nutrients it needs to recover and build muscle tissue. Maintaining a diet rich in high-quality proteins, such as those found in eggs, fish, legumes, or lean meats, along with complex carbohydrates and healthy fats, ensures enough energy for training and supports muscle repair after exertion. Moreover, micronutrients such as calcium, vitamin D, and magnesium are essential to preserve bone density and lower the risk of fractures. In this sense, each exercise becomes an even more valuable investment when supported by balanced nutrition. Ultimately, the consistent practice of these movements not only strengthens muscles or improves posture, it also protects the spine, stabilizes the joints, and trains the mind to react with composure. By holding a side plank or extending a bird dog, you gain more than physical endurance, you also cultivate discipline, patience, and control of your breathing. These factors directly impact emotional well-being, reducing anxiety and fostering a more positive mindset. Thus, what begins as a simple daily routine of just a few minutes gradually transforms into a powerful tool to age with vitality, confidence, and dignity. To conclude, it is important to remember that these exercises are not merely training routines but powerful tools for prevention and holistic well-being. Each repetition not only strengthens the foundations of human movement but also restores the body's natural ability to move with safety and control. Over time, this consistency translates into visible changes: improved posture, greater ease when walking, the confidence to climb stairs, and the peace of mind that comes from knowing your body will respond when it matters most. The secret lies in regularity and gradual progression. There is no need to spend endless hours exercising or to pursue perfection from the very first day. A few minutes, practiced with correct form and mindful awareness, are enough to trigger real improvements. What truly counts is listening to your body and respecting its limits. If pain or discomfort arises, it is wiser to adjust the movement, reduce intensity, or seek guidance from a healthcare professional before continuing. Remember, safety is always the foundation of progress. Equally important is to understand that aging does not mean losing mobility or accepting a sedentary lifestyle. Quite the opposite, each stage of life brings new opportunities to strengthen both body and mind. Functional exercises such as these offer an accessible, practical, and highly effective way to embrace those opportunities. They train strength, coordination, and balance simultaneously, creating a protective shield that allows you to move with confidence. This combination is more than just physical training. It is an investment in independence, dignity, and vitality. Beyond the physical benefits, these routines also nurture mental resilience. Holding a plank or extending a bird dog challenges not only your muscles but also your patience, focus, and breathing control. These qualities influence emotional health, reducing anxiety, sharpening concentration, and fostering a more positive outlook on daily life. In this way, what begins as a short routine of just a few minutes evolves into a transformative practice that enriches both body and spirit. If you found this content helpful, I warmly invite you to subscribe to the channel, leave a like, and share this video with someone who could benefit from these exercises. Together, we can build a path toward aging that is not defined by limitations but by strength, stability, and renewed energy. Let's move forward with determination, creating a future where every step is taken with confidence, every movement reflects resilience, and every day becomes an opportunity to live fully.